Get to know the current political issues, the real stories behind the headlines. Get interactive. My Politics with Art Barry. Only here on My TV Cebu.
Good evening, my dear televiewers. This is your host, Art Barrett, program My Politics. This evening, we'll discuss not on political issue, not because we shy away discussion on political matters, but we will discussing a piece of legislation which is also a very important topic. And for this purpose, atong invitar atong gusto ihinabi usa sa mga inila nga physician psychiatrist in Cebu, and aside from being a physician psychiatrist, he is also holding a radio program as well as a TV program in the other station. My friends, let's welcome Dr. Rene Obra.
Yes, Art. Good evening sa atong mga televiewers din sa atong programa, My Politics.
Yes, good evening,
It's a
and
pleasure
thank
to
you very
be
much, Doc.
invited to your program. I
And
hope,
this is not your first time.
yes,
Yeah.
not my first time. I was with Eric Espina and Bubit Avila.
I see.
So I hope I can cope up with the expectation.
So also with the other programs that
yes.
we have during our Tuesday 888 forum.
Uh,
Okay, anyway, Doc, let's talk and let's get to the point. No, Just recently, I think it was in 2018, President Duterte signed into law the Mental Health Act.
Yes.
And the Department of Labor and Employment has already issued guidelines for employers to ensure mental health and well-being in the workplace. That's a
Yes.
department administrative order of the Department of Labor and Employment. Could
Yes.
you elaborate on this particular piece of legislation, Dr.
It's a very interesting topic, Art, simply because for me, as a psychiatrist, I'm very much concerned about mental health. No?
see.
You know, left and right, up, down, side, right and left, I've been advocating mental health. Now, every opportunity, ako ginagawa ng mental health. Why? Because there is no health without mental health.
Exactly.
Yeah, we will go back to the basic, and I've been saying this time and time again that there are 4 factors for a person to claim that he is a healthy person. Ako nang balikon sa makadaghan para nga mag-guided ta going to the Mental Health Act. There are 4 factors for one to claim that he is a healthy person. Health is not the mere absence of a disease. Health is a balance between physical, social, spiritual, and mental well-being.
Okay.
So we really cannot do away with mental health. No? So like leprosy and TB, the word mental is stigmatized. You know what happened for the past years? Medyo nalipay ko. Why? Because compared to the previous administration, this administration give more emphasis and take a look into mental health. Na knowing nga nanatay mental health law, this will guide us, every one of us, to be mentally fit. No?
Okay.
So not long ago, I think that was last month of February of this year, Labor Secretary Silvestre Bilio signed into a guideline for the workforce or for the company to consider mental health as a part of their company's program of activities.
Okay.
This is very important, Arts, because a considerable number of our working force are not practically happy in their workplace for some reasons. No? So with this program of activities taking into account or prioritizing mental health issues, this can make our workforce, our workers, employees, happy in their workplace.
No longer expecting the 5 o'clock ingnon ta ang iyahang kutob sa iyang pagtrabaho.
Yes, it's because you are happy, contented with your work. you will not be looking at the clock to gaya sa balasing ko. Even if you will do extra work, no, overtime
Exactly,
work
yes.
without pay, you are rewarded, murag self-gratified ka, no? Because you are rendering service not because, of course, for your compensation, but because for your self-satisfaction. That you have done something to augment the status of your company.
Exactly, yes. That is the department order number 208.
Yes.
Yes, series of 2020. It was
Yes.
signed, I think, last month, Pebrero.
The Republic Act is 11036.
Exactly, yes. That's ang balaod.
Ang balaod.
Okay.
Oo. So,
Sa may role sa psychologist, psychiatrist
Yes.
on this aspect, Dr. Ren?
yes, the role of the psychologist and the psychiatrist. By the way, I'd like to differentiate the two because many people don't really know the difference between a psychologist and a psychiatrist. In fact, there was one time I was called to act as an expert witness in the court. They said, our next witness is Dr. Rene Obra, a psychologist. And I said, Your Honor, I'm not a psychologist, I'm a psychiatrist. You know what happened? What the presiding judge said? Oh, you are a mere psychiatrist, not a psychologist. You know, for the information of everybody, a psychology course is a preparatory course to medicine proper. I am a medical board exam passer. And after I passed the medical board exam, it took me 4 years to have a residency training program in psychiatry.
I see.
I took and passed the diplomatic exam before I can call myself as a psychiatrist. So a difference of 8 years in schooling and training.
I see.
So I think, klaro tadiha, no?
Psychologist is a field of science that you can only...
Deals with mind,
mind,
mental problems, no? But they are not doctors of medicine.
Yes.
They may be doctor of philosophy. No, that's the difference between the two, no? But I'm not downgrading this. In fact, one of my children is a psychologist, and she proceeded to medicine proper. No?
There's also a branch of psychology, they call it organizational psychology, something
yes,
like
the
that.
industrial psychology.
Industrial
we
psychology.
have the psychometricians. These are major subspecialty, no, or major. So going back to the issue, what is the role of a psychologist and a psychiatrist? So we can guide because we are healthcare providers, no? So we can do maybe some psychological biopsy. You know, in medicine, we have this what we call biopsy.
Yeah.
This is different from autopsy because when you say biopsy, the subject where you get the tissue sample is still living. When you say autopsy, the tissue sample that you get is from a dead person. But we have this what we call psychological biopsy. No? Psychological biopsy is our one way to evaluate, to know more about the person we're attending to. And you know what? There are so many issues about psychology problem or mental problem. No? So I hope that we can gradually destigmatize this word psychology, psychiatry, and mental. No, we cannot do away with all these things. No. In my practice, I have many psychotic patients, no? Of course, because I'm a psychiatrist. But, you know, I have more non-psychotic patients. And they are working patients. No?
I see.
They are working that maybe because of some reason, they just feel depressed, anxious, cannot sleep, don't really have interest to the previously interesting activities prior to the onset of the depression.
I see.
So these are factors that will come into play that we may say that this person needs help. But I repeat, this doesn't mean that he is psychotic or insane. It's because he has this kind of manifestations, no? The signs and symptoms of this kind of problem.
Okay. Dr. Rene, by enacting this into law, do you think this is one way of getting or preventing, or shall we say, nga ang tao nga at risk na aning kalakiha o na aning kaimtanga ang iyang stigma and discrimination at the workplace mawagtang or mag-guided ang employers?
Hopefully, mawagtang or ma-minimize. You know, in the workplace, there are times that an employee can be bullied by the manager. Bullying is not only physical. It could be psychological, sexual, or verbal.
I see.
Yeah. So if you are being bullied in your workplace, you feel anxious, you are not happy. So it will follow that you are less productive. You are prone to commit some gross mistakes. So I hope that our companies will follow this guideline of the Department of Labor to have this kind of mental health program integrated to their company policies.
Yeah, but if you are having this kind of problem, if I am an employee, and then the manifestation is within a borderline, is it not a ground for termination of work?
I think we have to also give justice to the employee. He is not performing well. Maybe he is not comfortable. Maybe it's either he is overworked or underworked. You say?
There are only two.
Only two. Either you are overworked or underworked, or you are having this what we call multitasking. Multitasking. No, you are a secretary at the same time a driver.
Yeah.
Or a bodyguard. You know what happened, Art? One time, there were a number of employees coming from a mining company. They went to my clinic and said, "Doc, we want to avail, with your recommendation, the sickness benefit claim, which is they are entitled to claim, no, as long as it can be justified by a professional like us, doctors, psychiatrists." So I said, "What's your work?" Then she said, "We are underground workers."
Underground workers.
You know, the first time that it came into my mind when he said underground workers, I thought that they are liftists or mga kining ato mga rebuildi, no? Pero when I asked more, I found out that underground worker is really very literal, factual, because they are working underground.
In the tunnel.
Tunnel. Kay mining lagi.
Mining man.
And I asked one of the engineers, who happened to be a close friend of mine, yung sa, you know, Ren, we put a blower on top. Blower on top to push air to the tunnel. So it goes with outside. It's expected that when you lack oxygen supply, because we need oxygen to be carried by our red blood cells to supply the different vital organs of our body, including our brain. So if we lack oxygen, our brain will become hypoxic, or we call that hypoxia, lack of oxygen supply.
That's a medical term.
That's a medical
lack
term.
of oxygen in your brain.
In your brain, not only in our brain, but also the
whole body.
The whole body. But our brain is our main,
the most vulnerable.
Most important. So you are more prone to develop some mistakes, and you are become anxious. Other signs and symptoms of anxiety, right? So I said, "Oh, well, anyway, okay, I will grant your request. I will recommend to your company that can get these benefits you intended or you expected to receive." And true enough, they were able to receive.
I see. The proximate example on that regard, Dr. Ren, kanamuagi ka sa South Coastal Road, sa tunnel, dagko kayo ng mga murang electric fan. I think that's the purpose.
Yes.
Okay? Okay. So we will discuss,
murang
blower. Okay. We will discuss that more on the issue of the Mental Health Act with Dr. Rene Obra after these reminders. Don't go away.